My lords, firstly, I would like to congratulate uh, Baroness Blake and Lord Lebedev on their maiden speeches, and I greatly look forward to working with them both. I'm grateful to be speaking on the gracious speech, and I'll focus my time on the Health and Care Bill. In doing so, I declare my interest as Chair of the Independent Health Providers Network. I'd like to make three short points. Firstly, the urgent need to tackle the elective backlog that has built up during the pandemic. Secondly, the need for the proposed new integrated care systems to be open and inclusive with good governance in place to avoid potential conflicts of interest. And finally, just to mention any other further delays in addressing the critical issues for social care. Tackling the growing backlog of elective care is the public's number one priority for the NHS, according to recent polling. And if not effectively addressed, this will be an issue which will dominate political and health debates in the years to come. Over recent years, NHS waiting lists have steadily been rising. And we now have a situation where over a third of patients, somewhere around 1.7 million people, are waiting longer than 18 weeks, with almost 400,000 people waiting over 1 year. Behind these numbers, my lords, are heartbreaking stories of people who've had to give up their jobs and livelihoods while they wait in extreme pain, and those who have completely lost their independence and quality of life. Given the level of current suffering and build-up of long-term chronic health problems, I'm sure that noble lords will agree with me that the success of this bill must at least in part be judged on whether it can reduce this backlog. And I would welcome the noble lord, the minister's thoughts on how the proposed changes in NHS structures will support local areas to better prioritise patient access to the care they need now. The response to the pandemic has undoubtedly shown us health is best served through a system of interconnected agencies from across different sectors, including local government, pharmacies, the voluntary sector, social enterprises, and independent providers. And that effective healthcare is not something that can simply be addressed by the NHS alone. So the move towards integrated care systems is therefore an opportunity to entrench the benefits of greater partnership, working and collaboration. However, talking to colleagues across the independent, voluntary and social enterprise sector, and particularly the mental health and pharmacy sectors, there's much to do to ensure the ICSs are not too NHS-centric, with too little consideration for the wider system with which the NHS seeks to integrate. And this is key if we're going to tackle health inequalities, with local voluntary, social enterprise and independent providers very often being much closer and more responsive to the local communities they serve than statutory bodies. We must therefore see integrated care systems established on an inclusive and transparent basis with good governance, clear accountability, and safeguards against conflicts of interest. While new ICSs should support the NHS and its partners to deliver joined-up care to local populations, there are real risks that the current proposals could lead to conflicts of interest around those who are commissioning and those who are providing healthcare services. For example, ICS partnership boards are likely to be led by NHS provider organisations. But blurring the lines between who is procuring and who is being paid to deliver public services poses a danger of a lack of due process and transparency. I would very much welcome the thoughts from the noble lord, the minister, on how such conflicts of interest will be identified and managed in ICSs to ensure their decisions are based entirely on the needs of local populations and not specific providers. Finally, while I welcome the mention of the much heralded plan for settling social care once and for all, as noble lords have said already, we have still to see further details of what this will entail. Given the importance of this issue to so many people, and all that we've learnt about the problems faced by the social care sector during the pandemic and the incredible efforts that have been made by providers to keep people safe, can the Noble Lord, the Minister, assure me that there will be no further delays in bringing forward some concrete plans and that we won't have to wait until the next Queen's speech to hear about these?